Hello, my name is Dr. John Wheel, and I am Associate Dean of Clinical Relations and Outreach at Lincoln Memorial University College of Veterinary Medicine. Thank you for tuning in to view this video, Student Evaluation by Preceptors, using the RIME schema. Let's begin. My goal is to go over the mechanics of how evaluations are provided by the Lincoln Memorial University College of Veterinary Medicine program. They are provided electronically via email. And I also wish to review the RIME schema and why the RIME schema is an appropriate tool to use to evaluate students. So our goal as a university is to graduate confident, competent, career-ready, productive veterinarians. That drives the method that we use for evaluation. The clinical experience that you provide is very important on meeting this goal. Participating engaged clinical affiliates are extremely important to student learning and attaining this goal. You and your team and practice serve as a role model to students. Students soak up not only what is discussed, but what is seen and observed during their clinical rotation. Before I go any further in discussion, I want to discuss student professionalism. Student professionalism is paramount. If you have any concerns regarding a student's professionalism or attitude, please contact us as soon as possible. If you have any concerns regarding student health, well-being, or other learning issues, please contact us as soon as possible. There are two general forms of student assessment: informal assessment and formal assessment. Informal assessment is the observational, in-the-moment feedback provided to the student. More information regarding this type of feedback may be found in an accompanying presentation on delivering feedback. Formal feedback occurs when a supervising doctor or preceptor sits down with the student and completes the end of rotation evaluation. We hope this also is shared with the student around this same time. We are going to discuss this further. There are two formal assessment points in the LMU program: at the beginning of the second week and at the last week of the rotation. These provide a formal, summative feedback and assessment of the student. So who exactly gets an evaluation of the students? Well, the student actually directs who receives their evaluation, completing a survey called the Who Did You Work With survey. At the completion of this survey, an email is sent to the doctors as indicated by the student. So it's imperative that you let the student know who they should direct their evaluations to. It can be more than one person. An email is sent to the student designated preceptor evaluator with a link to complete the evaluation on the student. This email comes directly from eValue. So, if you haven't received an evaluation, please ask your student if they've completed the Who Did You Work With survey, as this sends an email to the designated individual. If you can't find the email, please check your junk email folder. As it comes from eValue, many mail programs will treat this as spam and put it in your junk email folder. So this slide shows a sample of an email that one will receive the beginning of the second week and during the fourth week of the rotation. Please use Google Chrome as your browser and click or cut and paste the provided link in the email. You do not need a username or password. If this link does not work, please contact us and we will help provide you your username and password. Evaluations are very important to the student. The formal assessment and not providing an evaluation means the students cannot get a grade. They can't pass. They can't graduate. So please complete the evaluation in a timely manner. Each question on the evaluation are tied to the AVMA Council on Education competencies to assure student attainment of graduate veterinary skills, knowledge, and aptitudes. What's even best or better to do is to provide written comments on student performance by using examples and observations that you've had during the student's time with you. This provides valuable information on how students may improve. Areas assessed on student performance include clinical competencies, their skills and knowledge, and their professionalism when it comes to communications and actions and attitude. We've decided to use the RIME schema as our evaluation tool, as this aligns with Miller's Pyramid of Learning. The R represents reporter, an I interpreter, the M manager, and the E educator or expert. I'll expound on these 4 different categories of assessment. So in the upcoming slides, we're going to go into detail on each one of these areas. We have the reporter or beginner. We have the interpreter or advanced beginner. We have the manager, or competent student or graduate, the student or graduate who can run 80% of their cases. And then there is the educator or expert, who is quite advanced and actually teaches you, the preceptor, a thing or two. So we're going to look at this a little bit differently on this slide. The student progresses from reporter, interpreter, manager, educator throughout their clinical year. Depending on the subject, the student might be at different levels for a particular subject. It's a continuum. The journey from reporter to educator is ongoing throughout the clinical year and continues after graduation. You may wish to view the video by the developer of the RIME schema, Dr. Louis Pangaro. The RIME schema is used at over half of U.S. medical schools during their clinical rotations. The link is shown on this slide. We're going to go into a bit of detail now on each one of these 4 categories. The R, reporter. They can answer the what question. They have pieces of the puzzle that they can identify, but these folks might not quite know how to align these pieces to show the clear picture, but they certainly can identify normal and abnormal. So next we have the interpreter. These are the ones that are just beginning to develop their clinical reasoning. They are starting to line up pieces of the puzzle, the information that they know, and they are able to identify issues. They're able to develop a problem list, and they are beginning to put together a differential diagnosis list. They are able to answer the why question. So that brings us to the manager. They're able to accomplish what the reporter and interpreter goals are and more. They're able to start managing a case, putting over 80% of the clinical picture into focus by aligning all their information up, and they're able to suggest, test, and perform procedures to select the best diagnosis from the differential diagnosis list. They're able to select a credible treatment, and they're able to communicate this information to doctors, staff, and clients. They are able to answer the how question. How are we best going to treat the patient? This brings us to the educator or expert. This is an excellent student or colleague. They're more than prepared to enter the profession. These students bring a consistent level of knowledge, being able to put all of the pieces of the puzzle together and create a clear picture over 90% of the time. They have the knowledge And they share this knowledge with others. They do reading on their own, and they share this with others. They look for evidence. So on this slide is the review of the RIME schema and how it aligns with the LMU College of Veterinary Medicine program goals. The clinical year is a journey from reporter, interpreter, manager, and hopefully educator. LMU CVM's goal is to graduate again confident, competent, career-ready, productive veterinarians at a manager or educator level. As an important note, again, I'd like to stress that professionalism and interpersonal skills are extremely important. We expect all students in our program to demonstrate a high level of professionalism and interpersonal skill development at the beginning of their clinical year and throughout their clinical rotations. If at any time the student does not behave appropriately, please contact us as soon as possible. The sooner the better, so that we may discuss these issues with the student and make appropriate decisions regarding this issue. I wish to personally thank you for being part of the education of future veterinarians and the future of our great profession. And I want to thank you for being part of the LMU College of Veterinary Medicine clinical year experience. Thank you for your attention, and we appreciate your feedback and questions concerning this important subject. Please address your feedback and questions to the email provided on the slide. Thanks again.